Hi guys, welcome to Shine with Njoki Kamanja Kevi. Thank you so much because you're a good person who pressed play, meaning you're in the right channel. So today we are in the health talk and we have a beautiful lady with me. She's looking pink. So we are going to be learning about pelvic floor. And because I'm not an expert, let's go to the video so that she can introduce herself and we get to the topic of the day. Hi.
Hello.
How are you?
I'm fine, thank you.
Hey, you are here to outdo me.
No. See, I'm even in my uniform, so there's no outdoing.
You're looking like this, I can imagine.
You have to love yourself, Njoki, always. Yeah.
Just on the record that we have candles for self-love for this video.
Self-love first. You can't give what you don't have.
It's true.
Yes.
So you introduce yourself so that we can go to the topic of the day.
Okay. First of all, I want to welcome you so much.
Thank you.
In our center. It's called the Pelvic Floor Center. It's a center, a unique center of its own. So karibuni sana.
Thank you.
And even to our viewers, most welcome to our center. So my name is Dr.Alice. I'm a physiotherapist.
Oh, so you don't put Alice Maru. I've been calling me Alice Maru.
Either. Yeah, but I love Dr.Alice.
Okay.
I'm a physiotherapist and I'm a specialty. I have specialized in pelvic floor issues. It's actually a very new concept.
Okay.
Yeah, we are among with other physiotherapists among the first cohorts to do this.
Wow.
Yeah, so it is quite new, and we have been trained by the best.
Okay.
They're called the Herman and Wallace from the US.
Okay.
Sponsored by a very big organization called the Jacksons. So it's the one that has trained us. And so it's a very new concept to help the community with these issues of pelvic floor issues. Pelvis and pelvic floor.
Okay.
Yes.
So when I was coming, in my head, I only knew we were talking about the pelvic floor. But when I saw the entrance, we saw even about ejaculation. I was like, this is the health of this country.
Exactly.
So maybe we'll talk about that way later.
Later, sure.
Yeah, so let's get into the topic of the day, the pelvic floor. What is the pelvic floor?
The pelvic floor is an area of the body.
Okay.
The way we have different areas of the body. We have the upper body, the lower body. So it is an area of the body that both men and women have. Okay. Actually, a lot of people think that when we talk of the pelvic floor, it is only women.
Yeah.
So it is an area. It is an area of the body that both men and women have, and it's an area that contains muscles, different muscles. It is an area with bones, your pelvic bones.
Okay.
Yeah, these bones. And even your seat bones.
Okay.
Yeah, this area.
Okay.
So that is the pelvic area. It has bones, it has muscles, it has tendons, it has what we call fascia. Fascia is a thick layer.
Okay.
Yeah, it has what we call fascia. It has tendons, it has ligaments, it has fibrous tissues, it has glands, it has nerves, it has blood supply. So it's like any other part of the body.
Okay.
The same way we would be talking about the arm and describe the arm.
Okay.
Yeah, it's a part of the body. A very important organ actually.
Okay.
Yes.
What is the importance of the pelvic floor?
Thank you. So it has a lot of importance. It has a lot of functions. A lot. Because Njoki, if your mom didn't have a pelvis, you would not be here today.
It's true.
Yeah.
Yeah.
So it has so many. It has so many functions. It is the area that supports very important organs. Yeah, gives support because it's like a hammock. Let me call it a hammock. So you know a hammock? Yeah. It is the one that is down there supporting the organs so that they don't fall. If we didn't have that area, we would be going with our organs swinging. Yeah. So it gives support to very important organs. It gives support to your bladder, to your uterus, and even some organs of the male. So it first of all gives you support. It gives you stability. look at the way you're seated.
Yeah, because when you said about now behind,
Yes.
I was thinking now if I don't have it, I will even
Yeah, you will not be stable, yeah? And that is why you're doing these movements and all that, because it's giving you that very good support, stability. Sorry, it gives you very good stability. It also has a very important function of sexual function.
Ah,
Yeah?
now you have hit the point from.
Yes.
Yes.
Yeah? And so many people like that topic.
Very much.
But they are also shy to talk about
Now
it.
you see the topic, and now that part helps. That's why we are here, because of procreation.
Yes, yeah, because of procreation. Actually, when I was talking about the pads that it has, it has openings.
Yeah.
Yeah, so that is when that one comes in. With men, they have 2 openings, and with women, they have 3 openings. But funny enough, some women think they only have 2.
Imagine somebody told me that the same place anasusu now is the same place anazalia mtoto.
No.
Oh my God.
Yeah, some women think the same place they used to urinate, to give birth, to have sex. Yeah, so those are different openings. So it has openings. So it's also very important for that function, for sexual pleasure, and even it's the same area where we come from when we are being born. And then it has what we call a sphincteric function. Sphincters, you know about sphincters, like what you did with your eye is what, that is a sphincter doing that action. So the same thing down there, if you didn't have those sphincters, your urine will just be dropping, the fecal matter will just be dropping. But it is the sphincters that are able to hold. So we have some which are inside and some which are outside. We call them internal and external. So the internal one, it works by its own, it's autonomous. Yeah?
Like automatic.
It's automatic. And then there's a way it communicates with the outside one. So the outside one will tell it, hey, hold, not now.
That's why unaweza hold like mkojo.
Yes, that's why you can hold. You're like, now I just have to hold. But the inside one is telling you need to empty. And the outside is telling you no, not now, later on. So it has those important, we call them the 5 S's for support, sphincter, stability, sexual function, and we also have another one which does not have an S for breathing, and breathing, and there's also breathing. I'm forgetting the other one.
The normal breathing.
Yes, the breathing. Oh, we also have what we call a sump pump. Sump pump. It helps in helping in blood circulation. You know, it's like a second heart. Yeah, the same way we say our calf muscles, they help us in pumping blood. This is also a very important function, because when you're breathing, so it helps in circulation. Yeah. So thank you.
Okay, let's talk about the pelvic floor disorders.
Pelvic floor disorders.
Yes. What are the pelvic floor disorders?
We have a lot of pelvic floor disorders, and
but you could name just a few.
Oh, I could name just a few. So when you have a problem, you cannot hold urine. That is a pelvic floor disorder. When you cannot hold gas, that is a pelvic floor disorder. When you cannot hold the fecal matter, the bowels, cannot hold them, it's also a pelvic floor disorder. When a man cannot hold his erection, is a pelvic floor disorder. Yeah, before anza safari, when they are having a journey to go to Mombasa, by the time they are getting to Mlolongo, the journey is over, and you're supposed to complete the journey. It means there's a problem with that car. The same way it means there's a problem with your pelvic floor muscles. We also have what we call so we have premature ejaculation and erectile dysfunction. So you will find there's another one. The muscles are okay, they are strong, but he just ejaculates before time. So those are 2 different things. Yeah. So we also have an important function of being able to hold your baby when you're having a pregnancy. Yeah. You know, it's still a function of it, because when you have strong pelvic floor muscles, they're also able to assist you in holding the baby in place, ensuring the bladder is not falling off. So those are some of the even a prolapse. When you have a weak pelvic floor muscles, you may get a prolapse. And a prolapse, there are different types of a prolapse. It might be your bladder, it might be your wall, it might be even the intestines. They drop down. So when it is weak, yes, you feel a heaviness down there. And when you do the examination, sometimes it's so much you can see a whole of that, maybe it's the bladder, you can actually see the bladder looking at you like that. So there are so many problems with the pelvic. And I also want to state that it's not only weakness, sometimes it might also be too tight.
Because my question was also, there are people who are told that you are too tight such that mtoto hangetoka.
Yes. So sometimes those muscles are too tight. So it might be an issue of either too weak. So when it's too weak, it lengthens so much, or it's too tight. And now that one comes with a lot of pain. You know, when it's tight, there is pain, and that is why we also have conditions like what we call vaginismus. Vaginismus is when you're having painful sex because the muscles are too tight. They're just scared, you know. So those are some of the conditions of the pelvic floor muscles. And I always say it is an organ, an area of the body that is so much forgotten, and very important, because it is so much hidden, Joki. So even the problems, you hide them.
It's true. And also, you see, when it is a point where actually, you know, I don't know whether it's the Africanism in us. We're always thinking you can't talk about this part.
I will tell you, it's not an issue of Africa only. It's a worldwide thing. A lot of people will not come and tell you they have issues of the pelvic floor muscles. They feel like it's something that you don't just talk about. It's something that you talk in secrecy. And so many people will live with that problem for so long, and they will never talk about it. But it really affects them because it affects their quality of life, it affects them economically, it affects their self-esteem, because they are able to hide. Like now, Njoki, let's assume I have a problem with the urine incontinence. You know, I'd be in pads, and you will not know.
It's true.
And you will come here, we will talk, we will laugh, and I'm having that issue because it is so much hidden. So many people will also hide those issues. And so that's why I'm so glad it's a new concept in the country. We want to demystify. We want to demystify it. I don't know whether you will allow me to give an analogy.
Before we go there, maybe you can show us. I see we have diagrams here.
Yes.
Like you show us like a picture of the muscles around this area.
So I told you we have muscles, we have bones, we have ligaments. So I have a diagram over here.
When I came, I thought these are masks.
These are not masks. They look like masks, So maybe I can show it. So you can see this is how our pelvic area looks like. It's dome shaped, actually. It's dome shaped. Let's assume these are from both sides.
That one is for
but now these ones they're down here, actually. They're down here, but this is how it looks. So this could be in front, from in front going backwards. So you can see these are different muscles. These are different muscles, and you can really see this looks like a hammock. For holding. For holding. Those are muscles. You can see this is another one over here. So they are nice. So you can even find one is like that. It helps even compress to help you when you want to push down. They will also they will also help. So we have a lot of muscles.
There are so
Yeah,
many.
there are so many muscles.
Yeah.
All these you're seeing, these are different muscles. These are different muscle. This is a different muscles.
Why are they colored in different colors?
They're colored so that you can be able to see them well.
Okay.
They're not colored like that in our body. But you've probably eaten maybe a big piece of meat, and these are sometimes you can remove a whole when you so our muscles are like that, like now this is one group of muscle. This is a group of muscle. It's one. They always have different names. I don't need to. The names are so difficult. So these are different muscles. So many muscles. It is made up of so many muscles. You see, like now these are the muscles around our vaginal opening. This is the anal opening. We have muscles that surround it. They are muscles all over. There are so many. These are different muscles, Njoki. And we have another illustration over here. That now shows the bones. You see, this is now a half section of the bones. So these are the bones.
But we don't look beautiful inside.
We are very beautiful, Njoki. We want to say we are very beautiful inside out. Beautiful inside out. So this is how our pelvis looks like, and these are the bones now.
And these are
so you can see, like, this is the coccyx. These are the bones on this side, and this is around this area, where the baby will now be coming out. And now these are the muscles. The openings are here. Yes.
Wow.
So the three openings, you can clearly see them. This is now the urethra, the vagina, and the anal canal. You can see the three openings.
The last one is, who treats the pelvic floor disorder?
So we call it where we all work together. Multidisciplinary or interdisciplinary. Because there is when they come, first of all, you do assessment. You even do, they're supposed to be done tests that sometimes they might need to do maybe ultrasound, or all those have to be done to really establish the problem. So when you do the first day, you have to do a comprehensive assessment. Ask questions. How do you feel? Where is your pain? What are the symptoms? How, such kind of questions. Then after you do that, you will now be able to determine whether that is your patient or you need to refer to a gynecologist or a urologist, and also a urologist will go and realize this person, the only problem they have is just weakness of the muscles. We can call it stress incontinence, where medication will not help. So the only person they will send again now is to the physiotherapist to try and work on those muscles. The person might have a prolapse that doesn't need to be taken for surgery. So they will be sent to us to help work on the prolapse so that it goes back. And also, so we work as preventive. We teach people on how to take care of your pelvis so that you don't develop those problems. You're hearing it. And we work with you. We have a nice program with you. Maybe you run into the toilet so many times, and then it's just a small habit that you need to change. So we walk you through that. So it is not only one person to treat the problem, but it is
variety of experts.
Yes, variety of experts.
Now, why should somebody choose the Pelvic Floor Center?
Thank you very much. That's a very good center. So, first of all, you choose the Pelvic Floor Center because of the high professional values that we hold. We are well trained. I've told you we are being trained by Herman and Wallace. Actually, the instructors are from the US. They would come and train us. So we are well trained, first of all, and we are professionals. Then we have very, very unique equipment that we're using. Actually, the only ones in the country.
Wow!
Because when we are treating our patients, mostly we might use exercises, and so we have machines that also will help you recover fast, more effective. Because you might find that maybe I'm giving you an exercise program and I'm working with you. When I'm not using the machines, it might take us sometimes up to 3 to 6 months sometimes.
Yeah.
But with a few sessions, we start seeing the results.
Okay.
So it's a very new concept. We have machines from, equipment from German, actually discovered by a German doctor called Dr. Jordan. He's a urologist. He's one who came up with them because of the issues he was getting, especially we call them non-invasive, because we don't put anything inside.
Okay.
Yeah, but when we are doing our assessment, we will assess out, then even inside, because we are related from in, out, and in. Okay. So we do assessment in and out. Okay. But now when we are treating, it is non-invasive, so it's very comfortable. Okay. And you can see the place is
expensive.
I don't know what we call expensive, but I think the most expensive thing is and very, very expensive is our health. Okay. So I can never compare anything to our health.
Do you people use insurance?
Yes, we use some insurances. Yes, we use some insurances. Yes, but not all. We're still in the process of trying to have all of them. So what do
NHIF?
Watu wa NHIF bado tuko in the process. Actually, we are really fighting hard because this is an issue that affects from the small person to the big person. And you find it is so sad that when this person who has no cash is not being able to be treated. So we really want, and NHIF does a very good job because equal rights. Equal rights for all. Okay. Yes.
So now you're going to take us to a small tour so that we can see the center, so that they can judge for themselves.
No problem.
Not with the words that we are telling them.
No problem.
Yes. So stick there as you take a small tour, and then we are going to wrap up this video.
So Njoki, we have something here.
What? The carpet.
So as I told you, this is the pelvic center, but we have something also extra. We are talking about also self-love. Yeah. When you have a busy day, a day you're tired, your muscles are aching and all that. Yeah. We have a self-massage here. For people who don't want people to massage them with their hands. You know, there are those people. Yes, you'll have to test that, Jockey. Nice. You should have put the candles on here. This candle needs to be on. So this is it gives you a buoyancy. It gives you a buoyancy, and then it has some massage from deep down. It massages you from up down. If you're feeling your back is the one which is more tense, there's a way we set it so that it concentrates more on your back. If you feel it's your upper back which is more tense, there is a way we put so that it concentrates with you. So it is very good even after going to gym, you come and it makes you relax and relaxes your muscle. Yes. So this is our hydrotherapy. Yes, hydrojet. It's actually hydrojet for massaging your body. Yeah, it actually relieves even some pains which are not so deep. Yeah.
This one is another one.
Yeah, so these are our pelvic, these are the pelvic seat treatment chair. Yeah. It has some oscillations that oscillate like almost 18,000 times. It gives you around 18,000 Kegel movements in about 20 minutes. You know. So actually when you start, you even start low because it is quite powerful. Works on your muscles. So it gives you the Kegel. It's like when you have dialysis. You see the way the machine cleans your blood. It's the same thing now. This one helps you to work for you. You're getting it. Works on your muscles without you participating. You just sit, you don't undress.
So that's like in contractions of the weak muscles.
Yes, contractions of the weak muscles. The same way would teach you to do the Kegels. This one now does it for you. So what we will do is we will have to actually first of all examine, is it that they are tight? If they are tight, we will give you a program to relax them. If they are weak, we give you a program to strengthen them.
Okay.
You see, and we also give you home remedies. It's not only this.
Yeah.
We give you home remedies. You go, you work at home. You come and have our equipment. Then after a few sessions, we assess again. We do an internal assessment to assess how your muscles are faring. And we did it together such that you'd be able to tell, yeah, today I can feel the grip. Yes.
Wow.
Yeah.
Wow. So this is which area again?
This is the treatment area.
Treatment.
Yeah, this is the treatment area. And we forgot to start with our first area where we start by taking the vitals.
Okay.
We have to take.
Can we go there later?
Yes, we can go there later.
So
no, we don't need to. This is our washroom, because when you're coming over there, you have to clear your bowels, your bladder. Yeah, it has to be cleared. So we have 3 treatment rooms with the same. This is the same as that. This is the same as the other one, and even this third one is the same. Yeah, all these 3, they are the same. Yeah.
Are these perfumes?
Yeah, self-love. Hi. Self-love, Joki.
Maybe the camera guy can see.
Oh, yeah, self-love. Want you to feel welcome, want to feel you in the right place, to relax. Actually, when you're seated over there, we give you a magazine to read. Yeah, you can even sleep when you feel well. Yeah.
So that is an office.
So we combine both. It's not only that... There even some people will come and will not sit on our seats.
Okay.
It will be a one-on-one session to take them through. Maybe they need to work on their bladder habits and all that. So this is just part of the treatment.
Okay.
It is not a one-size-fits-all.
Okay.
Yes, there are those who need to sit on it. There are those who are contraindicated. Contraindicated means you cannot sit on it.
Okay.
Yeah, we have also contraindications. So when they come in, this is the first place they come for us to take your vitals. Vitals is to know how is your blood pressure, how is your pulse, how is those ones before, so that when it is elevated, we first of all take care of the.
So when you put your hand here.
Yeah, could you just sit? Just sit. We demonstrate. Put your hand. So you will feel a depression, Joki, someplace. Press it. Come kabisa on your knee. Come until you feel a depression somewhere. Come on. You felt it. Then now you relax. Don't talk. Don't move. Yes, until it tells you.
Blood pressure measurement will begin. Measurement completed. Your blood pressure is 100.
Yeah,
I'm good.
You're very good. So it shows us over here the normals, the optimal, when we have red flags, yellow flags. Yeah, you're doing well.
Wow.
Very well.
Wow.
Yes.
Thank you so much.
Karibu.
I have really loved the fact that you people are doing self-care with the candles, with the perfume.
I know.
That is so nice.
Yeah.
Thank you so much.
Karibu.
Yes. So, and before we leave, give us like the analogy.
Oh, I wanted to give an analogy when I was, okay, I almost forgot. An analogy is about why we should not think that area is not important.
Okay.
It is an equally important anatomical area. They are very important. So it's a small story to make you appreciate that area. So there are these 3-4 fellas. The mouth, the nose, the eyes, and the opening behind there, where we poop from.
Okay.
Yes, the anus, that is the name. So they are having an argument. Who is more important? Who is more important than the other? So the eyes were like, look, I can see you, I can see the colors you are, I can see the beautiful colors, I can see, yeah, if you didn't have the eyes, how would you walk? How would you even go to the washroom?
Yeah.
And they were like, yeah, I think you're very important. Then the nose had one word. If I closed, you die, you will not breathe. And there was no argument. The mouth, how would you be talking to me? How would you feed? So when the part down there they told him, please don't even go anywhere. You can't even speak.
Yeah.
And even the area itself felt it didn't have, it really hated itself because of the job it did of passing the most smelly, smelly, the waste, it was the last. It didn't even want to explain itself. It tried to say it is important, but it didn't even have the confidence. And so they decided they are going to do away with that part of the body, because after all it was not important. It was even ashamed to defend itself. So life went on as usual. That same day, the mouth really ate a lot of food. Ate and ate. The eyes were liking the color of the food. The nose was smelling the nice food, and the mouth ate and chewed and ate and ate and drank and all that. Njoki,
there came a time
after about 8 hours, early in the morning.
It's about time.
It was hell because the area was closed. So the body would not do anything. The whole body was in turmoil. They didn't even want to feel the smell of food. They wanted to vomit. The mouth was feeling like it wants to puke. The eyes were just popping out. The person would not do anything. He could not go to job. It was bad. And that is when they realized how important that part is. So it was brought back, and the speed the man rushed to the rightful area. And that is the time they came back and said, you are equally so important. So let us be proud of every part of our bodies. Equally important. All the body parts we have are very, very important. Yes.
That's a good analogy. At least now we will not be ashamed of any part of our body.
Actually, it is said, teach your children when they go to the loo nicely, and they do, even yourself, you say, thank you, Lord, I was able to do that function.
It is true. It is true.
Yes. So when they poop, they congratulate themselves, and then they will grow knowing it is a normal function. They will not be shy about it.
Okay.
Yes.
Thank you so much. God bless you for that analogy. And you as the viewer, know your anus is equally important as your eyes.
Yes.
If you shine with Njoki Kamanja Kebi, you're the light and you can shine.
Shine with Njoki Kamanja Kebi.